All right, now we're continuing forward for our competency assessment 1. So I have everything open on my sterile field, and I placed my eyewear on and did my full scrub. So you can refer to the full scrub video for education on that, a refresher on that. So I walked in the OR with my hands up, okay, my elbows away from my scrub top, okay. So I'm doing the same concept here. So 12 to 18 inches away from my gown, and I'm just going to use my pinchers because you notice how I'm dripping wet here. So I'm going to use my pinchers, and I'm going to kind of rock forward and grab my towel without touching my gown, okay? So I don't want to drip any water on my gown or my gown wrapper, or gloves for matter of fact as well. So stepping in, grabbing it, and then stepping back, okay? So now I'm going to go ahead and unfold this lengthwise, and then I'm going to go ahead and fold it in half, okay? All right, so now I'm going to go ahead and begin drying my left arm. So when I'm drying my left arm, again, I'm maintaining my distance, okay? And then I have my left foot forward, okay? And I'm kind of bending at the waist, almost kind of like a mad cat position, we call this, as I dry, okay? So the arm that I'm drying is doing all the moving. So notice how my right arm, or right hand, is staying stationary while my left arm does all the moving. The reason behind this is if I begin to move my right arm, this bottom here, this towel can come and touch my scrub top, thus contaminating the towel, okay? So then I'm gonna go ahead and rotate feet, and then rotate the towel. So my left hand is coming to the dry side now, rotating it here like so, and then I rotate my feet as well. So my right foot is forward while I'm drying my right hand, okay? Don't be afraid to take a little bit of time on this. It is really hard to get gloves on when your hands are wet. Again, my right arm is doing all the moving, okay? If I miss a spot, I cannot come back and re-dry it, okay? So I'm finished, okay? So I'm leaving it in the same hand. I don't want to rotate hands either, otherwise I'm going to contaminate my scrub. So I'm just going to hand my towel off and move forward, okay? So same concept here, so maintaining distance. So I'm going to grab my gown from the edge, or from the top of the gown, okay? So I don't want to come underneath or over the other edge where I can't see my fingers, okay? So I'm gonna use my pinchers, grab the gown, and step back. If it starts to unfold like this, that's just fine, okay? So I'm gonna go ahead and grab it with both hands, okay? And go ahead and face my, my Mayo stand, okay? So when I'm gowning myself, I'm opening the book away from me, as you can see. So the binding of the book is facing me, or the leathering is facing me here, okay? So I'm opening the book away from me, and then I'm just going to let it all unfold in front of me. I don't want to shake it. We don't like air currents in the OR, okay? So next, I'm going to go ahead and extend my left arm through. To do this, I'm going to step forward, and then I'm going to step forward with my left foot and pull with my right arm, okay? So notice how I'm coming straight forward. I'm not up, I'm not to the side, I'm straight in front of me, okay? Next thing I'm going to do is I'm going to go ahead and put my left hand on my belly button, not up here, okay, on my belly button. And then I'm going to go ahead and extend with my right arm forward as I step forward with my right foot, okay? And then my right arm is coming down my belly button, okay? Now I'm going to go ahead and ask my nurse, my circulator, to go ahead and tie me up in the back, okay? So they're going to come unsterilely and tie you up in the back. As they do this, you can ask permission, can I step forward?
Yep.
So I can begin placing my gloves, okay? So again, while I'm grabbing my gloves, I'm maintaining my distance here. And then I'm going to go ahead, I like to glove my left hand first, okay? So I'm going to go ahead and grab my left glove with my right arm, okay, or right hand. And then I'm going to go ahead and position my gloves. So while positioning my gloves, my thumb is going to go down on my left hand so I can't see it, with the fingers pointing towards my elbow, okay? And then I'm going to create my pinchers really close to my white cuff, as you can see, okay? So I'm going to grab this cuff on the left glove with my right hand, maybe, okay? And then I'm going to do the same thing, creating the pinchers really close to the white cuff. I don't want my hands to surpass the white cuff, because remember, this is not impervious. So if my hands come out the white cuff, then I contaminate whatever I'm touching, okay? Okay, so I'm grabbing the other side again with my left hand, so as you can see here, okay? Next thing I'm going to do is I'm just going to go ahead and flip my right hand over my left hand, okay? Okay, you're going to look something like this. That's okay. Now I'm going to start pulling my sleeve of my left gown to expose my left hand. Okay, I'm going to do the same thing. My right arm, so my right hand, so I'm grabbing the right glove with my left hand, flipping the thumb. So here's my thumb for reference. Okay, so the thumb is going down on my right hand with the fingers pointing towards my elbow, creating my pinchers as close to the right cuff as I can without surpassing it. And then left hand is coming over my right. Then I'll start pulling my sleeve on. Now I can start adjusting my fingers if I need to, since I have another sterile hand, and start pulling the glove on. Okay. Now I'm going to go ahead and ask my circulator to check my wrapper for me to make sure that it has no holes, rips, or tears.
It's good.
Okay. If it would have a hole or tear in it, then I would have to restart, or re-scrub, I should say. Okay, so now I'm going to go ahead and tie up with them. So I'm going to pull the left tab or left tie out of the card. I'm going to hand my circulator the card while they walk around me. Okay, I'll kind of step forward. So now as they're doing that, I'm switching hands. So I'm putting the left string in my right hand and then grabbing and pulling the tie out of the card. Okay, now I'm just going to go ahead and take a bow tie. And then I can approach my back table now, and now I can belly up. So I have a sterile surface now, so I can go ahead and belly up and put my second pair of gloves on. There's no special method for this. You can just put them on however you want. Okay, let's slide that there. So the next thing I'm going to do, so anytime we have something wrapped on my back table, I'm going to go ahead and identify and make sure it has an indicator before I move forward. Okay, so I'm going to go ahead and grab my light handles. Okay, I'm going to step away from my field, and then I'm going to go ahead and unwrap these light handles to find my indicator. So my indicator just fell on the ground, and I can see it's good from here. Now if I couldn't see it, then I would have to ask my circulator, hey, can you check that for me?
It's good.
So it's good, so we've got it, it's changed. Okay, I can use this towel, it's sterile, so I'm going to go ahead and take my light handles and place them in my basin. And then I'm going to remove my top basin and put it on my working corner. So my working corner is the edge that's closest to the to the foot of the bed, so I always use it as a reference. Notice how I'm grounding myself, turning my head, not turning my whole body, to identify where my working corner is. Okay, so from here I'm going to begin organizing. So to do this the easiest and quickest and most efficient way, I'm going to go ahead and grab my entire contents of my package, and I'm going to slide it all the way to the front edge opposite of my working corner, as you can see. Now from here I'm going to begin organizing. So the most, I guess the biggest thing here is I want to get organized as quick as I can to get my instrument set on the field. Okay, so my gowns are going to go to the front edge right next to my laparotomy drape. My towels are going to go in the back corner. My mayo stand and my trash are going to stay on top of my drape for now. Okay. Then I'm going to begin organizing my gloves and my surgeon's gown. So towel, gown, gloves. Same thing here. Okay. All right. Now I'm going to begin placing my towels. So the first towel is going to go on the front edge of my working corner. Then I'm going to grab my second towel, which is going to go on my working space here in the middle of my back table. Okay, and then I'm going to go ahead and make a roller towel. Okay, so I like to use 2 towels just to make it a little bit beefier. You can kind of play around with it and see what you like. Okay, so I'm unfolding it like so, and then I'm going to begin just rolling it. So I like to flip the corners forward and then just begin rolling it nice and tight. Okay, so this is going to go on the towel that's in the middle of my back table, just kind of right in the center almost. Okay, all right. So now I'm ready to go ahead and grab my instrument set. So I'm going to go ahead and step away from my field, not turning my back towards it, and go ahead and approach my instrument set. So Remember, the outside of this is still unsterile, so I'm maintaining my distance. Okay, so the first thing I'm going to do is check for indicators. So I should have 2 indicators on both sides that have turned black. Okay, so if they're white, then they haven't turned. So those are both good. So I'm going to reach inside, lift it straight up and out, and face my sterile field and ask my circulator, hey, can you check my filter for me? So they're going to check the bottom filter.
It's good.
Okay. While they're checking that, notice how, again, I'm keeping it away from myself. I'm not bellying it up against my belly, because if it would have a hole or wetness, then I just contaminate my whole gown and everything else. Okay, so I'm going to go ahead and place this in the center of my back table. Now the next thing I'm going to do is ask my circulator for my Balfour. So I treat that like another set. Okay, so I'm going to go ahead and grab myself and ask my circulator, hey, can you open up my Balfour for me?
Yeah.
So this is envelope wrapped as well. So Casson is just holding the contents of the packets while she's controlling all folds. And notice how I'm grounding myself and I have my hand here. Okay, so I'm going to check the indicator. The indicator is good. And she's going to check the wrapper for any holes.
Good.
Okay, so the wrapper is good. Then I can go ahead, and this is going to go in between my towels and my set. So my towel is on the opposite working corner. Okay. All right. Now I'm going to begin now I'm going to begin draping my Mayo stand. Okay? The reason I'm draping my Mayo stand before my basin contents is because some of my basin contents are going onto my Mayo stand. Okay? So I'm going to gather my Mayo stand drape, and you can refer to that video on how to drape a Mayo stand. Then I'm going to grab 3 towels in my trash bag and just place it on my working corner so I don't have to make as many trips over to the opposite of my working corner. Okay? So I'm going to go ahead and get my Mayo stand drape ready here. So I'm grabbing the entire package contents like so, cupping my hand, and then opening it up. Okay? So I'm going to go ahead, grab my Mayo stand. I'm going to ground myself on the feet, and then I'm going to belly up as I begin pushing it on. So I get my hands back. Okay, I'm going to ask my circulator to fix my cuff for me. Everybody fixing my cuff. As they're doing this, I'm going to go ahead and start placing my towels onto my Mayo stand and just tucking those underneath. So remember, my Mayo stand is sterile on both the top and the bottom, so I can grab and move it if I would like. Okay. Just placing my towels, tucking this underneath, so. And then my last towel, I'm just going to unfold once like so, and this is what we call our suture towel, where all our free ties will go. Okay, so that's going to go on the edge that will be furthest away from us, because remember, when we're up at the field handing, we're going to be on this side of the stand, so of the base of the Mayo stand. Okay. Then I'm going to go ahead and place my trash bag again on that side. That's going to be closest to me when I'm up at the sterile field for easy access. Okay. Now I can begin organizing my basin contents. So I'm just kind of going through this as whatever comes to me. Okay. So the next thing I have is my cautery, my light handles, and my suction. So I'm going to go ahead and gather all this contents, and then it's going to go inside my basin. That's in my ring stand. Okay. So the order of this is cautery on top, and then suction on the bottom, and then light handles on top of the cautery. So just like so. Okay. Now I'm going to continue to organize through my basin. I like to just grab all the basins and kind of dump them out to my working corner. I like to put my emesis basin just on the side of my large basin, and then my pitcher and my small basin I place inside the biggest basin here. Okay. My asepto I place in my emesis basin. Okay. And then this is my needle book, so I'm going to go ahead and separate this. So I have a magnet portion, and then I have a sponge portion. So The magnet portion is going to stay on my working corner, while the sponge portion is going to go on my Mayo stand. So it's just going to go on the edge that's closest to me. Okay. And then I have my med cup. I'm just kind of organizing with like stuff. So my med cup. Here I have my knife blade protector, which is going to go on the edge again, furthest away from me. Okay. And then my ties are going to go underneath my suture towel. I have my peanuts going on top of my basin. Labels I'm kind of organizing with my pen. And then we'll continue forward after this.